just for everyone's knowledge, we shall be doing the same series of webinars on functional medicine on first Saturday of every month. The timings will be same between 4 to 6 p.m. So, in the past, we did it on we did it on thyroid. And now, what we are going to do today, we are going to do it on detox. So, how detox helps us? So, the most of it will be covered by Dr. Musa sir. But till the time he joins in, I'll be in. Sir is here. So currently, I will be introducing you guys to Kshitija. She is the moderator for the session. So Ms. Kshitija is a chief dietitian at Lokmanya Hospital and Navjeevan Hospital. She is a consultant nutritionist at Synergy Hospital and lots of credibilities to her for over past 17 years. She has won the Vijeta Champion of India. Over to you, Kshitija. Thank you for being here with us. Kshitija? Okay.
उज्जवल भी तो है।
उज्जवल एक अफसर का भी होता है वो भी
Having some network issues. So allow me to introduce Dr. Musa sir. So as is she here? Kshitija, you are not audible right now. Okay, so I'll be introducing Dr. Musa sir. So, sir is an accomplished ophthalmologist with rich experience of 25 years. He has got certifications in functional medicines from esteemed institution of functional medicine. Sir is the founder of Ultra Wellness Clinic, that is a pioneer institute that specializes in the era of
समृद्धि
health
कानपुर
concerns, including metabolic syndrome, hormone health, mold toxicity, gut disorders, and autoimmune disorders. Plays a very crucial role in creating functional lab analysis software, wherein it helps us to understand how it works, how we can actually interpret our blood reports in a better manner, and advocates tackling the chronic disorders with the root cause. So, without wasting any time, I would request everyone to please be on mute, and over to you, sir. If you have got any doubts, any queries, we'll address at the end of the session. Thank you.
Thank you very much, Shankita, to introduce me. And before we can start the session, there are certain rules to attend the session. So everybody, please mute your mic.
सर एक्चुअली मैं उस मैसेज से नंबर थोड़ा सा कंफ्यूज थे क्योंकि आपने मैसेज में लिखा था कि मैंने उसको मैसेज किया है और उसमें ऐसा मतलब कोई रिप्लाई नहीं किया है। लेट्स सी इफ ही वांट्स टू, हम लोगों को लगा लेट्स सी मतलब वेट करते हैं, तो अगर वो
Ankita, can you mute everyone from your end?
अच्छा मैं एंड
Yes, I'm just trying to do that. Give me a moment.
Okay, that's good. So everybody, please mute your mic, and you are only allowed to ask question when video is on. I will not answer any question when video is off. I would not like to talk to a black window. So make sure you enter in a learning experience. So everybody, please turn on your camera if you want to ask me a question. And if you are serious about learning the functional medicine, please be on a somewhere place where nobody will disturb you, and there we can have a learning experience over here. So with that things in mind, let's start our today's session, that is on detoxification. So let me share my screen and hope everybody can see my screen, right, Ankita? Ankita, can you see my screen?
Not, yes, now we can see your screen.
Okay, so let's start and begin in deep dive in detoxification. So after today's session, you will be introduced to a functional medicine. So those who are new for a functional medicine, they will understand the basic fundamental of functional medicine. And those who already are in a series of this kind of learning, they will learn more deep in a functional medicine. Then I will teach you what are the pattern and what are the connection and dots that we going to connect within detoxification. I will teach you briefly about the physiology of detoxification. I will also teach you the biomarker that you should look for a detox defect. And then we'll learn about how to identify the root cause of a chronic complex disorder through a functional medicine matrix. And then finally, I will teach you what should be the approach when we find out the detox issues. So let's begin our first objective and let me introduce the functional medicine. So as you all know that we are passing through a tsunami of chronic conditions, and if you look at the statistic, 20 years back, we are suffering and most of death is because of acute infection disease, but now we are passing through a chronic condition burden where we see the majority of mortality is because of non-communicable chronic conditions. And you all know about these things. But let me briefly introduce the difference between the acute disease and the chronic disease. See, as we look at the conventional medicine model, we are based in treating the all kind of trauma, infections, acute disease. Let's say if somebody having an accident or somebody having an chest pain, we are best hospital. We are dealing in best thing in a conventional medicine for the acute conditions. But here we are not talking about the acute conditions. So everybody should be understand that functional medicine is based for chronic conditions. And as you know, chronic condition means the symptoms that last for more than 3 to 6 months. And we look at the many patients who are suffering for 5 years, 10 years. So we are talking about this kind of chronic non-communicable disease. And as you all know, they are the diabetes, hypertension, maybe some kind of detox issue. And today, we're going to deep dive in this detoxification pathway. So basic primary difference in a conventional medicine model, or we can say acute care model, and we can say a chronic care model, that is functional medicine. So if we look at from the linear point of angle, or if you look at the acute care model, then usually we want to find out the one cause for one condition. That is one to one. Let's say if the patient have fever, then we want to find out that particular organism that is creating fever. Or let's say if the patient is entering in a clinic with a chest pain, then we want to find out that one cause for that chest pain. But when we look at the chronic condition, that model will not work. And here you can see classical example of depression, where one condition you may be having a many cause. Let's say in one patient may be having a low T3 or
Hello.
low thyroid. In one patient, you
Hello.
can find out the
Yeah.
omega-3 deficiency. In one case, you can find out the patient might be having an antibiotic usage or vitamin D deficiency. And if you look at on the other side, then one mechanism, let's say one physiological abnormality, and that's the inflammation. So in one patient, inflammation can lead to heart disease. And as we know, CRP level is direct indicator of cardiovascular disease. And inflammation can lead to a depression or diabetes or thyroid or a cancer. So here we are dealing with a multiple complex conditions where we want to find out what is the reason or what is the root cause of that particular patient. And let's begin with the case study, because we had promised you in this series we will not talk about the theory. We'll talk about the all practical approach that you can implement in your practice. So let's meet Mr. Nayan. So everybody say hi to Nayan. And Nayan is 43-year-old man, and he is entering in our clinic with a chief complaint of itching, dark pigmentation in the skin, mostly around the neck and also the body part and back. He is also complaining about the fatigue and low mood. He is also suffering with constipations. And also he is telling that he is often having a dark color urine, and nobody know why he is having a dark color urine. And then he's also complain about the body pain. So when we look at from conventional medicine point of view, or when our thinking is linear, what we think. So if this patient is complain this kind of symptom again and again, and when the all non-specific treatment is failed, usually this patient enter in a clinic of psychiatrist, and final diagnosis could be a depression, and the only therapy that acute care model or linear thinking can offer is their SSRI. many patients enter in a depression, although they don't have a depression. So this is our linear thinking, and I would like to change your thinking from this linear, where we want to find out the one cause. Let's say all the symptoms, they doesn't because the patient having an SSRI deficiency, right? So everybody agree with me that this patient is not just a deficiency of some kind of antidepressant medicines. So let's change our thinking from the linear thinking to a complex functional medicine approach, and that I want everybody to just remove your conventional thinking, just keep everything on a side and just look at the case from a different perspective. And I want to change your thinking, and that's the rethinking in this case. And what the rethinking is, we redefine the disease. Now, if you look at the conventional medicine approach, our process is a linear. Now we want to change the paradigm. So if you want to understand the chronic disease, then we need to change our thinking. We need to have a new paradigm to understand. We need a different map and tools so we can understand the complex chronic condition, whether they have a defect, and we need a different framework to understand the clinical information. So if you look at the conventional medicine or acute care model, our thinking is based on anatomy. Now look at our different part of medicine. So we have a ENT surgeon, we have a neuroscience, we have a neurosurgeon, we have a cardiologist, and we had divided the body as per anatomy, and that's the best thing we can do for acute care disease. But here we talk about the chronic condition. So that acute care model that is based on anatomy and pathology will not work here. So we have to change our thinking, and we have to change from anatomy to a functions or a physiology. So whole functional medicine science is based on a functions, that we want to find out the dysfunction. Let's say in this case, Nayan, when you look at the symptoms, we don't find out a specific disease, but we can say his body or his some system is not working well, and that we can say it's a dysfunction. So we change our paradigm of thinking, like we can say the disease and the health. So you just imagine that the disease and health is actually a continuum. So on one side we have wellness. So when we lose the wellness with some point of events in a time, we call so-called health, we achieve that part, and when we even lose the health, we actually achieve the disease. So actually it's a continuum. So we have to change our system from a physiology point of view, not from the disease point of view. And my simple understanding about the optimal health and optimal function is, if we leave chasing the disease, and if we just chase the health, and if we can create the health, disease will disappear. On another way, if we can improve the functions, if we can identify the dysfunction, and if we can improve the function, the disease will disappear by itself. So just change your thinking from the disease to optimal health, and that's what we want to redefine in a functional medicine. So if you look at the functional medicine principle, so it's basically a biology-based approach. I will not say that functional medicine approach is not an alternate science. It is based on a biology science. It's based on physiology, where the primary goal is to find out the root cause of the disease. And today, in Nayan case, we're going to learn how we can achieve and how we can find out the root cause. Then if you look at the primary cause of the disease, so let's say, what could be the disease or primary cause of the disease that we want to get rid of? So if you look at the broad understanding of the disease, then these are you can find out in the root. So as you know, today we're going to discuss about the toxins. So toxins can be biological, can be internal, can be external, can be synthetic, or we can say allergy. Many patients suffer with an allergy or mold toxins, or maybe there are some other pesticides, or they are reacting to some kind of allergens in the environment. And also you can see infections. We can say it can be bacterial. Here we don't talk about the acute infection. Here we talk about the chronic infections, like chronic bacterial infection, chronic viral infection. Stress, all you know that physical stress or even biological stress we can leads to a disease. And then finally, you all know that poor lifestyle that include poor diet and so many things. So these are the primary cause of all the disease that we
लगाओ यार, है ना?
and
थोड़ा बहुत टाइम दे देता ना तो
So first question, so every patient, they walk in our clinic, they ask one question subconsciously, and that question is, hey doctor, hey therapist, hey nutritionist, how I have this symptom. So Nayan is asking me, hey doctor, how I develop this disease, how I develop my low energy, how I develop the mood disturbances, right? And that the primary question we want to answer. And that for that, we have to learn the one primary tool that we call a timeline. So with the timeline, you can find out the disease. See, disease will not appear suddenly. Let's say patient have nothing on a Sunday and Monday morning he wake up and he have a low energy. Again, we are not talking about the acute condition. We are talking about the chronic condition, and chronic condition take years and years to develop. So that's why we need a different tools and different angles to understand these chronic conditions. So let's say how Nayan had developed his symptoms, and for that I want you to familiar with the timeline. So everybody will going to learn the timeline. So in conventional medicine, what we do, we usually take an history in 5 minutes. We ask the chief complaint, and we don't find out anything. We run a basic lab, and then we want to jump on single diagnosis. That in Nayan case, doctor usually put a diagnosis of an depression, and then we put on some kind of pharmaceutical medicines. But if we want to find out the root cause, first thing, we need more information. Now, the more information, to collect the more information, we have to change our narration. We have to change our narration to a from the chief complaint to a current concern. See, patient is suffering with an symptoms for many years. So we cannot just look at the chief complaint. So we have to change our narration, and that's what the patient is presenting. They are just on current concern. Then we can collect the information from various form. Let's say we can collect the information from lifestyle questionnaire form, or we can collect the information from family history and life event. You want to also collect the information regarding the symptoms, because patient cannot tell everything in that interview. So before patient enter in our clinic, usually we send some questionnaire and then we collect the information. So first thing, if you want to reach and if you want to get the answer how the patient has developed the disease, then we have to collect the information. So we gather the information, and then finally we need to learn this simple tool that is we call a timeline. And with the timeline, we can find out the first question answer. And let's see in Nayan's case how all the information we had collected from his forms, and we had plot them into a timeline. So here is his timeline. I would like to teach you everybody how to create a timeline and how we can find out what are the antecedent, trigger, and mediator. So you can see this patient have a family history of cancer, depression, also is eczema, and also is family history of jaundice. See, in conventional medicine, we usually think that the most the disease they are appeared because of genes. Yeah, I agree, genes are important. But if you look at the current medical science, then genes are not our destiny. So it is a new science coming that says that it's the gene expression that is responsible for the disease. And how can gene express? And that's based on your environment. Let's say if your healthy environment, even if you have bad genes, they will not trigger. And if your genes are not triggered, you will not develop the disease. So yes, genes are playing a role, but with the genes and family history, we can say they are just antecedent, and that is the risk of developing disease, and how it passed through his life, that determine, and how much environmental exposure he is having, that determine the disease. So usually we collect the history even before the patient's birth. And you can say patient is born with cesarean section. So that means the patient's foundational gut microbiome is not there, and he might be having a risk of developing any kind of inflammatory disease later on. So again, I'm saying they are the risk of developing the disease in future. Now, if you look at the patient infancy, then we have a history that patient, when he is born, he is having a physiological jaundice that what doctor had diagnosed, and they had treated the jaundice. But usually we can see and we can have information that there is some issue with your bilirubin metabolism. That's what we get an idea from his history. Then patient is telling us in a childhood he's having a frequent illness and frequent headache, and he was taken some course of antibiotic because, and then we see when the gut microbiome is not properly formed because of whatever the reasons, and again if the patient is taking too much antibiotic, that disturb the gut microbiome. And we can discuss the gut microbiome in some other way, but right now you just understand that that can antibiotic can leads to a disturbance in a gut microbiome. And usually you can see the patient is telling that in a whole childhood he's having an underweight. So we can say that he might be having some kind of nutritional deficiency even in early childhood, and he is not having a proper weight. And then at the age of 13, the patient started developing some kind of issues with the skin, and the primary complaint he is having is itching. On and off he is having an itching, and that she is observed. At the age of 18, the patient had developed a mild jaundice, and that he says because of some medicines he had taken, and followed by his medicines, he had started developing a mild yellow sclera and mild jaundice, and he was investigated for hepatitis, and all the investigation of jaundice is done, and nothing came out except a mild elevation of bilirubin, and doctor had concluded that he is having some kind of reaction within medicines, but even the cause is not found. And then age of 18, again he had a mild jaundice, and nothing is found out except the bilirubin level is mildly elevated. And at the age of 22, he is entering in a aviation industry, and he is learning as a pilot, and he had almost from 10 years he had worked in a aviation industry, and he was a pilot. And when he started his job, eventually, initially it was everything was fine, and then within a 5 to 7 years, he started developing allergies, and he started developing sinusitis. And then he has investigated for that, and doctor had find out that patient having an DNS and polyp. So usually doctor will advise a sinus surgery, but patient had not gone for that surgery, and that surgery according to me is not required. And then patient started within 5 years of the chronic inflammation, chronic allergies. He had started developing a low fatigue and low energy, and that was his primary concern, how he came to us at the age of 43. So now if we look at his timeline, then we can get and find out some reasons. He is not developing, and you can see the timeline, and you can find out the patient has some kind of genes, and you can say he's having some issue with an jaundice. And if you look at the jaundice and bilirubin, then you can say there is some issue with an detoxification pathway. So his detox function is not proper, and that's why past history is getting some issue with an detox dysfunction. So here from the timeline we can see classically, or we can conclude even, that the patient having some dysfunctions in his detoxification pathway, and that's why he might be having some toxic overload when he was working in aviation industry, because we know the aviation industry in a plane, they are exposed to many chemicals in that environment, and that's, or maybe it's allergic chemicals they are entering from the nose, and if we cannot detoxify this chemical load, and because of allergy and chemical load, he is having some dysfunction in immune system, and then how is entering in a dysfunction. So from his history we can say like he's having some kind of immune dysfunction because we had find out the allergy, and one dysfunction we had find out is some kind of detox issue is there, and that's why he is, and because of long-standing immune dysfunction and because of long-standing detox function, maybe there is accumulation of toxins in a cell, and because of toxins his mitochondria is not working properly, and that's why he's presented with a low fatigue and low energy. So this is the story we can get from timeline. So if we take a timeline properly, we can find out some story, and we can tell the patient story that this is a dysfunction that you had developed, and that's why you enter in my clinic. So with the timeline, now we have idea that patient had developed this symptom because he is passed through some kind of dysfunction and some kind of exposure of toxins in the environment, and he has difficulty in dealing with that toxins, and that's the reason he is entering our clinic. So let's understand the physiology, the basic physiology of detoxification. So we have more idea about the detoxification. So I want everybody to participate in this question. So as you all know that we are exposed to many toxins. So my first question to all the audience is, do you agree with me that we are exposed to more toxins and more environmental exposure of toxins in recent year? If you are agree with me, please write down yes in a chat. I want everybody to participate in this activity. Are you agree with me that we are having an exposure of toxins in a recent past? Yes, so we are on same page that we are passing through a lot of toxins, and those who are still not agree, let me show you something over here, and you will just look at this one. Can you see this letter? And you can see the letter that is written to the PMO, and this letter date is 2019. Now let me read this letter for you, so everybody should understand. Even our government is doing. This letter is drafted by the Keralian government, and Keralian government is telling to the PMO, and if you can see, that's an urgent notification that we should look at this matter seriously, and that matter is glyphosate. So Kerala government is doing a study since 10 years. So they have started the study in 2013 with an agriculture department of Kerala, and they had come out with the research, and they had find out the insecticide they are using in the agriculture field, that is glyphosate, and glyphosate is toxins to even earth microbiome, and they had find out the glyphosate concentration high in all vegetables and fruit, and they are writing to a PMO in 19 that this is an urgent matter and we have to completely ban glyphosate in India. Can you imagine? In 2019, almost it's a 6 year, and what we are doing. And if you look at the letter, they are clearly mentioned that they had find out the high concentration of glyphosate in all the vegetables and the fruits in the market, and they are telling government change the policy and ban the glyphosate. Still, in India, glyphosate is not banned. There are 20 to 25 countries in the world, they have banned the glyphosate, but still in India, we are using glyphosate in our agriculture method. So we are destroying so many things. So I'm not talking about a detail of study. If you want to learn more things, then you can just write down in a Google, you can find out a lot of article about the glyphosate. So I just want you to convince that I'm just taking one example, the glyphosate. I will not talk about the pesticide, you very well know. And that's why I want you to believe that we are exposed to chemicals, we are exposed to many toxins, and that's why we need to learn the physiology of detoxification. So I want to change the narration as we are discussing. Everybody knows the detoxification, but that is not enough. We have to change our narration. We have to change our word from detoxification to a biotransformation and elimination. There are two processes in detox pathway. One process is biotransformation, and second process is elimination. So detoxification is not a complete word. Complete word is biotransformation and elimination. That is called phase 1 and phase 2. So everybody know that we are what we eat. Yes, everybody know that we have learned this sentence from many, many years. And also who we are what we are eat, drink, breathe, touch, think, and finally what we can't eliminate. And that's why here we are here to learn the physiology of detoxification. And that's the cellular process. So here, if you look at a broad spectrum of toxins, then there are two variety of toxins. One is fat soluble and other is water soluble. As you all know, vitamin are classified as a water soluble vitamin and a fat soluble vitamin. Here, we are not worried about the water soluble compound because we can easily eliminate when you expose to water soluble compound, they are absorbed in your blood, and from the kidney, it can be readily excreted. We don't need a biotransformation for water soluble toxins. And from the skin, and even from the liver, and even from your kidney, we can eliminate this water soluble compound. But here we are worried about the fat soluble toxins. And now my another question to you is, everybody know that non-stick cookware is not good, but do you know why? The non-stick, they contain a Teflon, and do you know what is the half-life if you are exposed to a Teflon? If your Teflon is reaching to your bloodstream and reaching to your cells, then do you know how much time it take to eliminate that Teflon from the body if everything is normal? So in other way, how much time your liver and the body will take to detoxify that Teflon? Anybody know? Anybody have a guess? So half-life of Teflon is 8 years. Just imagine, your body will take 16 years to completely eliminate that Teflon. So that's why we are worried about the fat-soluble toxins, and we should be having and we should understand the pathway of detoxification biotransformation. So let's understand, deep dive in our mechanism of detoxification. So as you see, we have phase 1 and phase 2. Phase 1 is biotransformation, and phase 2 is, we can say, conjugation. So we can convert that toxins in a water-soluble compound. As we know, we cannot eliminate the fat-soluble toxins. We have to convert them into a water-soluble compound, and that's why we have a mechanism in the liver that we can transform the toxins. So it's very simple that you can say, if you want to eliminate the parent compound, that parent compound has to enter in the liver, and then liver, by the phase 1 reaction, so we have enzymes in the cell, all the enzyme system, we can say P450, and that enzyme system will do either oxidation, either it can do a reduction or hydrolysis, and it will create an intermediate compound. So why we have difficulty in detoxifying the fat soluble compound? Because they are not readily in a position to eliminate, because they are fat soluble, and we have to convert that parent compound into a water soluble compound. And that's why in each and every cell we have an enzyme system phase 1, but the phase 1 enzymes are more concentrated, more prominent in our liver cells. So if the parent compound is entering in the liver cell, if the enzymes are active, they convert them into intermediate active compound, and then we have a phase 2 reaction where we bind something to this intermediate compound. And when we bind this something to intermediate compound, they convert to a water soluble compound. And then from the bile, we can readily eliminate that in a gut. And from the intestine, it will come out in the feces. So we have a various phase 2 mechanism. The prominent mechanism is UGT enzyme. Then we have a sulfur conjugation. We have a amino acid conjugation. We have a glutathione conjugation, and we have a methylation that will convert the parent compound, intermediate compound, into a water-soluble compound. So let's see a simple example. So everybody know about the codeine. So codeine is used for cough, but the codeine is a not active compound. So when you take codeine, which are phase 1 enzymes, it will be converted into a morphine. And then morphine has an effect, and then morphine is converted by the UGT enzyme, and then it can be eliminated from your liver. So majority of all the chemicals, including your medicines, they will pass through a phase 1 and phase 2, and then how it is eliminated. So it's a common pathway. If you look at the caffeine or coffee, also you have a same pathway. If you look at the paracetamol, then of course you have a same pathway. So all the pharmaceutical, all the chemical, they pass through this kind of phase 1 and phase 2 reactions, and depending upon their pathway, they're going to metabolize. So you will create elimination from this phase 1 and phase 2 reactions, right? And let's see a simple example of bilirubin. So everybody know the bilirubin, right? And how the bilirubin is eliminated. So bilirubin is the toxins, and when your RBC goes in metabolism or the heme part, when it's converted, or when we want to destroy the RBCs and the heme, that heme is converted to unconjugated bilirubin. So unconjugated bilirubin means that it's actually metabolites of your heme metabolism. So when your heme metabolism, you're going to convert and create the bilirubin level. So your RBC, your bilirubin level. Now bilirubin is considered to be a toxin, and we have to eliminate the bilirubin through the liver. So this bilirubin through the blood, it enter in the liver cell. And in a liver cell, we have a UGT enzyme, and that's phase 1 reaction. With the phase 1 reaction, it will going to bind this bilirubin to a glucuronic acid, and this unconjugated bilirubin is converted to a complex that is with a glucuronic acid, and that's called direct. So unconjugated, then it's become conjugated with the phase 2 enzymes, and now it's become a water soluble. So if you look at the bilirubin level, so unconjugated is not a water soluble, then conjugated or direct is a water soluble, and this compound is going to eliminate from the gut, and you can see from the gut 80% is excreted from the feces, and you can see 18% is again entering back into circulation. That's called enterohepatic recirculation. Now you can understand why the gut is also important. So everybody know that detox we have to learn, and we have to work on only on a liver, and we work on a liver, and everything is fine. But you can see working on a liver is not enough. We have to also work in a gut. So if you have bad microbes, or if you have dysbiosis in your gut, and if you have a prominent bacteria that uses the same pathway, then it will deconjugate. Your liver is conjugating the toxins, and again, if you have bad bacteria in intestine, they will deconjugate this complex, and again the primary compound will be absorbed in your intestine, and that's we call enterohepatic circulation. So that's why apart from liver, your gut should be functioning properly, and you should be having a good bacteria in your intestine. Now with the same thing, we are coming back to our patients, and the same patient, if you look at the liver enzyme, then you can see that patient's alkaline phosphatase is slightly on lower side, and that shows me that patient might be having a deficiency of zinc, or patient might be having a deficiency of B6, and then you can see is both the enzyme SGOT, they are in normal, but you can classically see that is bilirubin level is slightly elevated. Now, if you look at the direct bilirubin level, it is 51, and you can see unconjugated bilirubin level is 9.92. So you can see that now you understood the unconjugated bilirubin that is coming from the RBC, and now it's going to bind and it become a conjugated bilirubin, and then it's going to excreted in the bile. So when you make a mathematical formula, you can combine these two things, that become a total bilirubin level. So now we can understood that there is some issue with an conjugation, and that's our phase 2 pathway. So we have a phase 2 pathway, and that is called glucuronidation. And with this case, we can say that patient have a difficulty in a phase 2 enzymes. So we, in a conventional medicine, even we can say this disease as a Gilbert syndrome, but this patient has some kind of genetic variation, and because of that variation, his phase 2 enzymes is not working properly. And if the phase 2 enzyme is not working properly, he cannot conjugate the bilirubin, right? And if he cannot conjugate bilirubin level, the amount of unconjugated bilirubin level is increased. So again, the same fundamental, parent compound and then intermediate compound, and then we have to convert them into a water soluble compound. And this patient have a difficulty and dysfunction in phase 2 enzyme, and that's why always his bilirubin level is slightly on higher side. So depending upon, if you look at the timeline, we had seen there are 2 episodes where he has a mild jaundice, and he had said that there was a drug reaction. Now, if we understand that 2 episodes of an jaundice, why this happened, and because of drug reaction. So let's say if the patient is exposed to a same drug that use the same pathway, and he cannot eliminate the same drug, let's say paracetamol. So if the patient is exposed to a lot of paracetamol, what will happen? He cannot metabolize the paracetamol because paracetamol is using the same pathway. And if his all the enzymes are busy in that detoxification of paracetamol, he cannot convert his bilirubin level to unconjugated bilirubin level. So his bilirubin level is slightly increased, and once he has a more increase of bilirubin level, you can see the symptoms, or you can see the yellow urine or yellow sclera in that case. So we can have some idea about how this patient is developing even jaundice in the past. So these are the biomarkers we should understand, and from the biomarker, what we are diagnosed is we have a complete analysis of the lab, and but from the lab analysis, what we had find out is patient having an phase 2 detox issues. Also from the report and also from the history, we had find out the patient is allergic to something. That means the patient have an immune dysfunction, and also we had seen the patient also having a methylation defect, and that's he is also having a high homocysteine level. In some other point, we can discuss the methylation defect, but right now, just focus on a detox defect what we had find out in this patient. So from the timeline, from the blood biomarker, we had find out some dysfunctions over there, and that their dysfunctions are the immune dysfunction, detox dysfunction, and also he is having some methyl dysfunction. Now all the information we want to plot. So before we can come back to the patient, let's understand how we can find out the root cause. Now, if you look at the screen, then we have something that we can tell to the patient, and that we can say is antecedent, trigger, and mediator. With an antecedent, trigger, and mediator, we can say the patient that this is the problem, and that's why you are entering in our clinic. So how he developed the disease or conditions, we can say from that. And then we want to map and find out what are the clinical imbalance or what are the dysfunction this patient is having. So from the timeline and from the lab, we had find out that patient having a dysfunction in immune system, patient having a dysfunction in his detox pathway, and also because of long-standing inflammation and long-standing detox issues, he has some issue in his energy metabolism that we can say his mitochondrial dysfunctions are there. And finally, in the root, we have to find out what are the modifiable lifestyle factor that patient have an imbalance in that particular things. So we plot all the information in a single timeline matrix, and we can find out the root cause. Now, if you see this timeline, then look at the bottom. What we had find out in the bottom. We had find out in the bottom that patient have a disturbed sleep. He's a pilot. He's working in this industry for many years, and he has disturbed sleep for many years. Then if you look at the exercise, he's sedentary. He's not doing exercise properly. Whenever he get the time, he do maybe once or twice a week, he do for walk. Then we had taken the dietary history, and we had find out his diet is typical deficient in many nutrients because his job is not allowing him to do a proper diet or healthy diet, although the diet is available everywhere, but he is not very fond to having a good healthy diet. So we had find out many deficiency in a dietary pattern. Primarily, we had find out the protein deficiency, and of course, he is passing through a lot of job stress because he has low energy and he cannot focus and work. and that's create a more stress in his life. His relation is okay, he don't have any issue with the family and everything is fine, but you can just look at the modifiable lifestyle factor. Now we had find out this is the root, right? And then on the left side, you can see patient's antecedent, means his family history. Then the triggering event that we can see stress or antibiotic, or maybe on and off he has a detox issue or exposure to a pharmaceutical that is not detoxifying, or we can say mediator. They are the toxic exposure or allergy exposure, or of course a nutritional deficiency that is suffering. Now, if you look at the center, then as we are discussing, we are moving our thinking from the anatomy to a physiology. Physiology means functions. Now, we have 6 major functions in the body, and that function is, we can say, a gut function or assimilation. And then we have a defense and repair. So everybody know that immune system is for defense, but I would like to tell you that immune system main function is not defense. Its main function is repair all the time. Immune system is repairing the cells, so it is removing the dead cells and is creating a new cells. So that the main job is to repair. And we had find out the allergy high IgE antibody. That's why we can say he is having some kind of immune dysfunction. Now you can see energy metabolism. We have a energy that should be proper because each and every cell need energy. And even if you look at the detoxification functions, then it's energy dependent. We need energy to biotransform. And if you look at the mitochondria, then I would like to give you information on mitochondria that each and every single normal cell, they contain averagely 800 mitochondria. And do you know why our heart is pumping all the time? We don't take a rest because we have almost 5,000 mitochondria in a single cardiac cell. And that's why your heart is pumping all the time. Is mitochondria is providing the energy to to the heart cells. And at a given point of time, our brain uses 25% of energy that mitochondria produce in our whole body. And we have seen in this case, the detox issue that we are classically discussed about the bilirubin metabolism, that's we call a Gilbert, and then methylation defect is there because we had find out the high homocysteine. So in this case, classically, we can see the 3 prominent dysfunction: immune dysfunction, energy dysfunction, and liver, or we can say biotransformation dysfunction. So this is the root cause. We don't want to see the only single case. This is because of he has having single exposure or one factor that leads to disease. That is not the case. This is his root cause, and that's why he is developing. So now, if we want to get his health back, then we have to work in all these things. We have to work in his sleep. Eventually, we have to work in exercise. So we have to increase the perspiration so he can sweat and he can remove the toxins. We have to work on diet. We have to work on stress. We have to remove the mediator, because mediator, or we can say a perpetuator, they keep on disease or dysfunctions. So we have to work on mediator. We can start working from anywhere. We can start working on immune functions or energy metabolism, or we can start work from detoxification. But in this case, we are choose to start from detoxification, and that's why we had make some treatment approach for detoxification. Now let's understand the basic of functional medicine. So now we had learned the major 2 tools, the timeline, matrix, and how to map. So I would like to give you idea about what is functional medicine. Functional medicine, as we are discussing here, is not alternate medicine. It's not just a medicine to taste something, or it's not a medicine to just give a supplements or diet. It's a way of thinking. We should change our thinking, and how we address the disease is not just then focusing on one area. We create a map. And then if we tell the patient, then this is a map, if you walk in this direction, ultimately you achieve your health. We focus on a map that we want to find out the pattern of dysfunction, and we want to focus on a one pattern, and we want to correct that pattern from other conditions. Then we want to find out and focus what is the root cause, as we are discussing the clinical imbalance. What are the root? What is a modifiable lifestyle factor the patient is suffering with? And then focusing, learning, creating balance. As we are discussing, not chase the disease. Instead, you work on a functions. And if you can learn the art of balancing the functions, then actually you can reverse the disease. And that's what we are discussing here. So are you guys, my first question to you, because we have learned the phase 2 physiology, phase 1 and phase 2. So if we want to design the treatment, then what is your opinion? We should start optimizing the phase 1 or we should start optimizing phase 2? So please write down in chat. Then we can discuss a final objective. We can finally go to the objective, how we can optimize phase of detoxification. Okay, we have a mixed review of phase 1 and phase 2. Some people are saying, so almost I conclude that 50% are saying that we should optimize the phase 1 and we should optimize the phase 2. So let's understand from where we should start. See, as I mentioned you, what is phase 1 and phase 2? Phase 1, we're going to convert that primary compound into reactive intermediate compound, and that is more reactive and more damaging. So if your phase 2 pathway is not optimized, and if you only work on a phase 1, what you will create? You will create a more damage, because the intermediate compound are ready to react within your cell membrane. They are ready to react with your mitochondrial membrane or even the cell membrane, right? So phase 1 is not the first goal. We have to optimize the phase 2. And if we optimize the phase 2, then we have to work on a phase 1. So let's learn how to optimize this phase 2. So as we learn in phase 2 reaction, there are many methods, but one of them is, in this case, I would like to teach you that this is the way our body is approaching toxins. So toxins is in phase 1, then phase 2, then we are phase passing through a phase 2, and then we have to make the toxins out. So before we can work on a phase 1, we have to optimize the phase 2. So let's learn how to optimize phase 2. Because if you think about the liver detoxification, primarily you only know that either we can prescribe NAC or N-acetylcysteine and milk thistle, right? That's what the detox pathway mean for you. But here we're going to learn a different approach. So first thing first, we have to avoid the environmental toxins. So the basic rules of toxicology: we have to remove the toxins from the patient's environment, or we have to remove the patient from the toxic environment. So either we can remove the toxins, or if we cannot remove the toxins, then we have to remove the patient from that toxic environment. So that's the only fundamental. There is no third options when we look at the primary fundamental of toxics. So what I mean to say is, we have to minimize the exposure. Whatever the exposure you can minimize in your home environment, reduce the plastic use from the food, go to the organic foods, or whatever things you can do is. The first principle is avoid the environmental toxins. I will not go in detail how we can do these things, but you all know how we can minimize the environmental toxins. And then as we are expert, we are expert in nutrition and we are a professional, so we want to prescribe some foods and we want to prescribe some nutritional approach. So first thing you have to learn is fat and oil. Of course, you know that we have to shift the patient from omega-6 to omega-3. And for detoxification, you can see ghee and coconut oil or flaxseed oil. They are my primary fat and oil I would like to prescribe in some good quantity to the patients. So all you know, because you are in nutrition, so I would not like to teach you what's the importance of fat and oils. But the therapeutic functional food for detox pathway is your ghee, your coconut oil, or your MCT oil, or you can see a flaxseed oil. They are important. And as we are learned in functional medicine approach, nuts and seeds, so you can see all nuts are important, but here, as we are discussing the therapeutic food, and I would like to make you understand about the sesame seeds and the flax seeds. They are important because they have some nutrient that can help you in optimizing your phase 2 and also optimizing your phase 1. But nuts and seeds, they also provide the protein, and they also provide some therapeutic benefit to your detox pathway. The most important thing is your protein. So if you look at the phase 2 pathway, we have an amino acid conjugation. If you look at the sulfur, second pathway we have discussed is your sulfur or sulfur conjugation. So you need sulfur containing amino acid. So amino acid is a major pathway. And if you look at even your fat, the basic understanding, like cholesterol. So if you had discussed previously in a cholesterol metabolism, then as you know, fat are not soluble in water, and that's why we have to combine this cholesterol to a protein, and that we see in a lab as a LDL cholesterol or HDL cholesterol. So it means if we want to make something soluble in the water, the best way is we can bind the amino acid to these toxins. That's the major pathway. So just imagine that you want to prescribe something and you are thinking that I should prescribe milk-thistle to this patient, although patient is protein deficient. So what you approach? We approach protein deficiency, or you just thinking the same linear thinking that my patient is having deficiency on some kind of phytonutrient. For here, the example is milk thistle, and let's prescribe the milk thistle, and patient will be come out of his detoxification. If your thinking is linear, then you are doing the same thing what your conventional medicine doctor is doing. But we do a different approach. We first work on protein. We first work on omega-3 fat, and that's the basic things you have to learn. And if you are specifically working for detoxification, then the first protein that you prescribe is either soy protein. So when I talk about the soy protein, I am not talking about the soya chunk, because you understand this one. I'm talking about the tofu or soy milk. Don't just think and your patient is taking an soya chunk and they are getting the protein. Soya chunk is processed. So when we talk about soya or any kind of protein, we always talk about the organic that contain a nutrition, not just an artificial or some food that is made in factory. So protein is very important for detoxification. So that's why you should work first on protein before we can work on any other nutrition. And this is the importance of soy. I will not go in detail. If you want to take it, then you can take a screenshot. But they contain a methionine, and as you know, methionine also contain a methyl donor. And methionine is important for your detoxification. So they contain isoflavonoids, they contain other nutrients, they help in optimizing your phase 2 pathway. So if you are thinking that my patient is not allergic to soy, again, we have to rule out the soy allergy, of course. And if your patient is not on a soy allergy, you can verily prescribe. In this patient you had seen, we had not found out any kind of food allergy or the autoimmune condition. So we had prescribed him soy product, soy tofu, and he can take an soya milk. And of course, we have to prescribe the non-starchy vegetable. Now you understood why. Because we want to increase the gut microbiome diversity. And if you can increase the gut microbiome, it will prevent the enterohepatic recirculation. That's why you will not absorb the toxins again. In many cases, we are seen either estrogen or either some toxin they are actually recirculating. And that's the important pathway we want to stop. And that's why we all know that this is important. Now here, I will show you some list of phase 1 nutrient and the food source. As we know that in phase 1, we have to optimize the oxidation, we have to optimize the hydrolysis, and we need some B vitamins, and we need some kind of flavonoid phospholipids. So you can see the list, they are nutrient important for phase 1, right? So you can just take a screenshot and you can keep these things and you find out what are the food source of B2, B3, B6, B9, B12, And of course, these all vitamins are important for methylation. They are important for your energy metabolism. So if you look at this kind of B complex, they're also important from your energy metabolism or mitochondria. And then you need a quantity of your glutathione, and that's the antioxidant, the major antioxidant in your cell. And even you look at the detox pathway, then you have a glutathione conjugation. So these are in the branch chain amino acids. So you can see the amino acids are important. So these are the phase 1. And then specifically, if you look at the food source of phase 2, and as we are discussing, we required methyl donor. That's the methionine. We required methyl donor you can get from the B6, B9, B12 folate. Then you require the sulfur containing amino acid, that's your cysteine or N-acetylcysteine. Then you need glutamine and taurine and glycine. So glycine is also important to bind some toxins. So you have to optimize this nutrient. So first you're going to work on sulfur methylation, and you work on amino acid and protein, and then you start creating your treatment focusing on phase 1. So these are the important understanding of phase 1 and phase 2, and that's why you need to understand what we had done in that patient. So come back to Anayan. So we have a case, we are discussing that case. In that case, the dietary changes we have done is basic, good protein, healthy fat. We increase the nuts and seeds. We prescribe them a plant-based protein. Then we have to think about creating an vitamin A rich foods. So this is a homework for you. So you have to find out what are the food source of all this nutrient what we are discussing over here. So find out what are the good source of alpha and beta carotene. You know, one carrot, but you can find other source. Quercetin rich foods. Then you can find out the high D-glucuronic acid as we are discussing. He need glucuronic acid, and that what is deficient. So if we have to increase the food that is in a glucuronic acid, so you can work on this bilirubin conjugation. Just think about that if patient is deficient in glucuronic acid, how we can conjugate the bilirubin level, and that's why we want to increase this glucuronic acid. Then citrus food, they contain antioxidant and vitamin C. Magnesium rich food. Magnesium is very important to convert and detoxification pathway. Then we have to increase some anti-inflammatory food, and you all know curcumin. And finally, dietary fiber, plant-based fiber. So these are the basic food dietary changes that we had done in this patient, and then we had prescribed some nutritional supplement. And my primary goal for this patient is to correct his protein deficiency. Then I would like to correct his omega-3 deficiency. See, when you look at the omega-3 deficiency, don't just rely on a capsule. Dose is important. So therapeutic dose of omega-3 is almost more than 2 grams. See, when you look at the supplements, I want you to understand that there are two ways you can think. One is therapeutic intervention, and second is you can say maintenance. When you talk about therapeutic intervention, your dose is different. Usually you require a higher dose for therapeutic intervention. And here are some dose mentioned that omega-3, we require almost more than 2 grams. Quercetin, we required almost 1 gram. And if you want to work on NSC, usually we required 1 gram. And homocysteine, they contain a B2, B6, B9, B12, TMG, and magnesium, even I would like to go higher, more than 400 milligram, but 400 milligram per day magnesium is good enough for him to start. So this will optimize his phase 2 pathway, and also some phase 1 pathway, some enzymes of phase 1. But my typical goal is to control his inflammation, and my typical goal is to optimize his omega-3, omega-6 balance, and my another goal is to optimize his phase 2, and that's what I had prescribed him nutritional supplements. And then here, because we identify that he is having a Gilbert syndrome, so these are the trigger of Gilbert syndrome. So here, last point you can see, you cannot prescribe the high dose of vitamin B3 apart from many medicines. Make sure you know these things, and if you find out the Gilbert syndrome or high bilirubin, don't prescribe high dose of vitamin B3. So look at his multivitamin. or whether he is taking in vitamin B3 in the past. And there are certain medicines. So these are the medicines, they use the same pathway where he has a defect. So you can see ECM, you can see the ibuprofen, you can see some antibiotics, typically rifampicin. So let's just imagine that this patient, if you find out any patient who had a tuberculosis and the doctor had prescribed him rifampicin and he's also having a Gilbert syndrome, right? So he will increase his bilirubin level because rifampicin use the same pathway, and there are many antiviral medication they use the same pathway, and chemotherapy drugs. So um, let's say if you have a patient with a Gilbert syndrome, and if you are looking at the medicine, just Google is which pathways they are using. Now we all learn that the Gilbert syndrome or high bilirubin level, they use the glucuronidation pathway. So just check. You will find out the information in Google if you are confused with the medicine. And finally, we have to work on a lifestyle, and I will not go in detail, but there are many lifestyle changes you can do to optimize the detox pathway. But here, I would like to teach you something else, and that is infrared sauna. So everybody know that infrared is helping in detoxification. So there is a one pathway where you can increase the sweating, or there is a infrareds, they can stimulate your skin, and even in deeper way, they can stimulate your kidney to detoxify the water soluble compound. And even in the liver, we are seeing that when you convert to a water soluble compound, even your skin and your kidney can eliminate these toxins. And that's why sweating or infrared stimulation is that you can advise if you want and detoxification process to be a smoother. So guys, would you like to learn how I create an infrared sonar lamp for my personal use? If you want to learn, then please show me something on chat. So you had heard there are a lot of sauna and they're expensive. If you want to buy something that you can buy for 2 or 3 lakhs and you can put in your home, and then you can just find it out that for you, or you can just see even if you are going for any kind of infrared sauna once a week, they will not going to help you. It should be your treatment approach, and that patient has to, or we also, as we know, that we are also exposed to many toxins and we want to detoxify, right? And that's why we want to make some strategy that we can do infrared every day for 20 minutes, 30 minutes, that we can do it. Sunrise and sunset, yes, they will give you infrared, but just ask yourself, how many patients are exposed to sunrise and sunset with the full body? Can you go it in the sun? I cannot go. I cannot go in my balcony, or I cannot go in my terrace without clothes. Otherwise, they will say me that this is some madman, and they will throw out me on society. Right. So only we are exposed to a infrared of sunlight when we go in some vacations where we go on a beach. That way you can expose yourself, or if you're lucky enough that you can go in. But here, and that's, I'm not denying that sun exposure is important, but here we want to talk about the therapeutic intervention. Sun you can consider as a maintenance. So if you want to learn the my way of doing these things, then you will get the email. I will not teach you here. I will send you email to every participant. And if you are not registered to the event, make sure you register. And Momita will put a link of event registration. So if you register, you will get the email how I did and how this worked for me. And of course, it will work. It's a very cheap method. Will show you each and every step you can do it. So you can just create your own infrared therapy that you can use for 20 minutes a day. So make sure you registered this event.
Yes, sir. I'm sharing the link in the chat box for everyone to get registered.
Mm-hmm.
Yes.
So those
Please find the link in the chat box, everyone.
those who are registered for the
Okay.
event, they don't need that one. Otherwise, everybody can just send their emails. Send the email.
Momita, I would request you to send the link
Yes.
on the WhatsApp group or share it with me. I'll put it in the WhatsApp group so everyone can register there because everyone is out there. The
Okay.
entire
For now, I have
community.
shared in the chat box and I will share that to you also.
Perfect.
Okay.
Okay, so you will learn the my way technique. So I handle a lot of R&D, so your time will be saved and you will go on the same pathway. Okay, so let's move on progress of this case. Now tell me that if you optimize and if you work on this way, now I just want you to ask the question. So if you work on this way, if you work on dietary changes, if you work on nutritional supplements, and you work on lifestyle, you tell the patient don't expose to yourself to triggers, and then you work on lifestyle. Do you get the improvement in patient's condition? Do you get the improvement in detoxification? Do you get the improvement in your patient's symptom like an energy, fatigue? Of course, yes. That's what patient is saying to us. When patient come back for progress, we check the homocysteine level, we check the bilirubin level, their improvement. They improve in the mood and energy. You know, one thing this patient is happy is he get his energy back. That's what he's looking for. So now he can focus, he can work, and he is motivated to continue doing this one. In 43 years, no doctor tell him that he's having a Gilbert syndrome and he's having a detoxin pathway and don't take paracetamol. Simple understanding. So now he understood that he has to take care of all his liver so he can prevent the disease. Right? Can you help to open? Now we have a question. We can answer the question later on, and that's my issue. So all the professional, if you want to start your journey in functional medicine, I want you to scan this one and you can enroll for functional medicine foundation course. It's very easy, where you can learn the tools, the basic tool we have described over here. The tools you can learn in detail at your own pace. And I want, if you are serious about learning functional medicine, just enroll for the course. It's very easy, where you can start learning a basic foundation of functional medicine. It's almost more than 4 hours, and you get all the tools over there. With that things in hand, thank you very much for listening. And now we can discuss some question that is on chat box. Yankita, can you read the question for me, or should I go and read the question?
I'll do that, sir. Thank you so much. I would just request if I can get the slide pic of the QR code which you shared right now. So I'll share it in the group as well, so people can scan it, because right now in the session it will be a bit difficult for everyone to scan it. So if I can get a screenshot of this particular slide on my WhatsApp, I'll share it across in the group.
Sure, Amita will send.
Surely. So I'll just go to the questions which we have received. Just a moment. There is a question for how do we go ahead with the methylation?
Okay, so methylation is actually a pathway that you can see, the detailed pathway. Even we can do a special discussion on methylation pathway, but for your understanding, methylation is a basic process in each and every cell. So if your methylation is not correct, that you can see from the blood biomarker homocysteine. And if your homocysteine level is not optimized, that means it's showing me a methylation defect. And if you are methylation defect, then it's very important that you understand it will help in detoxification, it help in energy, it help in neurotransmitter, it's the anti-aging marker, it's a methylation is also the marker of cardiac health. So methylation is a central process where everything is connected. So if you look at all the body function, they are actually connected to the methylation. And one of the methylation issue is in detox pathway, and that's why we want to optimize methylation. See,
Okay.
in nutrition, if you want to do a single test, and you just want to say my patient is having correct nutrition and everything is fine, you do a homocysteine level. And if your homocysteine level is less than 7, don't do anything.
Okay.
All
So
the
there is a question the patient is pregnant, first trimester, is detoxification healthy in that condition for mother and for a baby?
See, detoxification is healthy in pregnancy also. We have to work on that one, but we have to we cannot go in a therapeutic intervention for that mother. Let's say if you want to do some kind of infrared, that you can do it. That's fine. If you want to work on a phase one, let's say all the treatment we had shown for phase two, optimizing the protein, fat, optimizing your B vitamins, that's good for mother and baby both. So you can
Okay.
work on a basic things, and if you and that will sufficient for mother, and it will also help in other way also.
Okay, but provided with a proper guidance
Yes.
is what you would recommend?
Yes, I will
Okay.
recommend that it should be a personalized approach. That is what we cannot make a generalized statement that every pregnant woman go on this way.
Okay. One more question. Soya is considered as an anti-nutrient. So is it still recommended irrespective of autoimmune conditions such as Hashimoto's or else soy products in female who might have estrogen dominance?
Okay,
So these are the
that's
some questions.
that's a very interesting question about the soya. So as you look at the detoxification pathway, soya is important. Now, if you look at from nutrient point of view, then there are anti-nutrient. Now, listen me carefully. When you want to recommend soya, don't recommend the soya powder, because the soya powder also contains the anti-nutrient. Recommend and go for tofu and soya milk. Now, what is tofu? What is the process of making tofu? When they will soak the soya for more than 24 hours, they will grind it and they will just take out the soya milk. The rest of chunk will go out. And from the soya milk, they will make a tofu. So there is a process of making a tofu and soya milk. So if you ask me, what is my recommendation for soy? The first thing, I will rule out the autoimmune condition. Second thing, I will not prefer the soya for young girls because they are passing through menstrual cycle and they might be exposed to estrogen. Third thing, I will not give a soya to my estrogen dominant patient. And then I will prefer the soya for this kind of patient, like is a male patient, and then we want to work on detoxification pathway. He's a vegetarian, so I would like to increase the soya from tofu and soya milk. So that is my go-to selection for soya.
Okay. Thank you so much. We have one more session. Can fasting help open phase one and phase two pathways?
Yes, fasting will not help in phase one, phase two pathway, but fasting will help to mobilize the toxin from your cell to the liver.
Okay.
That way you can do fasting. But of course, you think about all the detox pathways actually energy dependent. So you cannot go for long fasting or you cannot go for continuous fasting because you want to optimize the energy. So you cannot go in a calorie deficient, low energy because all the detox pathway phase one and phase two, they are energy dependent. You require energy for that.
Okay. Someone has asked what all lab functions needed to be done. I believe the homocysteine is what sir answer. Anything apart from that, sir, would you like to?
See, basically, if you want to do, and then I would like to repeat on basic blood biomarker, you see, uh, as we are learning, the patient is not presenting just for detoxification issue because there are multiple issues, right? So we want to run a basic panel where we want to rule out the glucose metabolism issue, thyroid metabolism issues, kidney issues, right? So you will run the basic panel. Basic panel is all your cardiometabolic panel, including your nutrition, including your homocysteine, including your liver enzymes. I would like to check the kidney function because kidney is also the detox organ. You have to run a whole panel where you can find out dysfunction.
Okay. So there's one more. Grade 3 fatty liver is reversible. Uh, Miss Shilpa has asked this question, and if we can get your insights for the same.
Okay, so what is grade 3 fatty liver? See, fatty liver means your liver is creating fat and then the fat is deposited in your internal organ, I will classically say the fatty liver is because of metabolic conditions. It's a sign of insulin resistance. Again, we have to find out the root cause. I will not say the answer, but I will ask you a question to think about. See, here in functional medicine, we do rethinking. Now, what is the rethinking? What is the cause of fatty liver? Second question, why my liver is depositing fat in the liver itself? Do liver has an option to deposit the fat somewhere else? Do my liver is only congested with the fat, or my kidney is okay? My kidney doesn't have any kind of fat, or my other cells doesn't have a fat. Find out the root cause. Create the map. Create the timeline, and you will find out what is the reason for this grade 3 fatty liver. See, our thinking is like linear. We want to find out the one problem, and we want to find out the one solution. That is a linear thinking, and that linear thinking work based in acute care medicine. Now here we are in functional medicine. We want to go through all the process. And if you go through all the process, you will find out the reason for fatty liver. You find out the nutritional deficiency. You will find out some issue. Find out some issue with your gut. Just map, create the matrix and timeline. You will find out the root cause. Once you find out the root cause, work on that. If you work on that, definitely grade 3 fatty liver is reversible. I had reverse grade 2, grade 3 completely, right? It will take time, but it's completely reversible. See, you have to find out the pathway where your liver can just eliminate the fat. And if you can find out this pathway, you can work on this one. Your liver will get rid of the fat. That's a simple thing, right?
So, thank you, sir, for the answer. The next question we have, what are the six minimum functions in the body? As mentioned, one is gut function, other is detox and immune. What are the rest three?
Okay, if you look at the basic physiology of human body, then you can say we have an assimilation function where we can see our respiratory system, our gut system, and that's the assimilation function. Second thing, we have discussed about the defense and repair, that's the immune function. Third thing is energy metabolism. Fourth thing, already today we have discussed about the detoxification. Fifth thing is we can see a transport system. See, we have a transport system. You can consider cardiovascular, not only the cardiovascular. You transport the hormones, you transport the fat, you transport the nutrient. So we have a transport physiology. And finally, you have a communication node. Communication you can consider as a hormones or neurotransmitter. Our one endocrine organ communicate with all the cells. So we can say a communication node. And finally, if you want to add one more, then that's your structural integrity. So if your structure is proper, your cell is proper, that also play a role in functions.
Okay. Uh, we have an amazing question. For how many days phase one and phase two last for the detox or the duration?
Yeah, that's a very interesting question. Now, let me tell you, phase one and phase two, they are the continuous process. It is not an on and off kind of system that we are on and we are off. It's almost a continuous process. You continuously exposed to toxins. Toxins are not only from the environment, we also produce toxins like the bilirubin level. So bilirubin is a phase one and phase two is a constant process. We conjugate bilirubin, we remove the toxins. So phase one and phase two is a constant process. Now we have a certain foods and we have certain medicines. They can either stimulate the phase one or they can shut down the phase one. I'll give you a simple example. If you heard about the antifungal, so all the antifungal they're actually suppressing the phase one. So that's why you should learn in advanced learning what are the factors. They are the inducer of phase one and phase two. So this is another whole learning that we can stimulate the phase one and even we can stimulate the phase two. But for this question to answer, phase one and phase two, it's a continuous process. Each and every second, your liver is doing this. and even some extent, all the body cells are doing this one.
Okay. So, this question is slightly different than what we discussed today. It's regarding oligoscan. Is it good test to understand the heavy metal toxicity, or should we opt for any other blood test or any other test like oligoscans?
See, the gold standard for any kind of heavy metals, we can see is it's a urine heavy metal testing. There are certain chelating agent that you can prescribe, and that's a challenging test. So if you look at the testing, there is no perfect testing for all the heavy metals, but as per my understanding, I will grade the first testing that I would like to do is a urine mycotoxin, a urine toxin panel, where we can see doing a challenge, and then we can see the concentration of metals in a urine. This is my first job. Second test you can do is, of course, hair mineral analysis, where you can find out the chronic toxicity over there. And then last test I would like to do is your serum testing. Now coming to oligoscan. See, oligoscan is an instrument they are developed, and they will find out some frequency from your palm. I will not say that this is a wrong science or out of sky science, but uh, that is not the although perfect test to find out the
Okay.
toxicity, right?
Okay.
Because we don't have a correlated data. But if you look at the this is one of the method to find out the frequency. So what they will do, they will do a scan. They do get the frequency from the tissues, and depending upon the frequency, they're going to say that this is mineral is high or low, high or low, high or low. That you can use as a one of the test. But I will not completely understanding. My understanding is I will not get the complete or final information from that oligoscan.
Okay. So, and the next question is, what could be the dose or amount of ghee, flaxseed oil, or coconut oil would be recommended from your end per day for the individuals who are going on detox?
See, usually
And how can vegetarians help through detox? Does sprout and whey protein help?
So coming to your first question, what are the fat or flaxseed oil indications? See, if you look at overall indication, like 30% of food should be contain healthy oils, because our body is majority of fat, right? So usually when I design, I would like to look at the patient's total calorie, and then I would like to calculate a 30 to 40% of calorie should be coming from the fat. And if I would like to prescribe the thief fat, then usually I prescribe an 10 ml of ghee, 10 ml of coconut oil or MCT oil, and of course the 10 ml of flaxseed oil. But if your patient is not ever taken this kind of healthy fats, start slow. So one important understanding I would like to give you from here is, more complex the patient, more slow you go, right? So let's say
Mhm.
in this patient, then I can prescribe a 40 grams or 50 grams of all the oils. Even I can prescribe 10 grams. But if you see one patient who is too much toxic or too much complex conditions, we go within 20, 30 grams or 2 or 3 grams of flaxseed oil, and slowly we're going to increase. So that is not a single answer for everybody, but the understanding is the more complex, more slower we go. And if the patient is not complex, you can prescribe to 50 to 60 gram. Even if you want to work on keto, then you can prescribe 90 to 100 grams of fat a day.
Okay. How about the vegetarian interventions? Will they be benefited by sprouts and whey in
Yes,
this
definitely.
country
Yes,
for
definitely.
detoxification?
The first thing we have learned is protein deficiency. And if I would like to give you data, then ICMR has done a study in 2015, 10 years back. I don't have recent data. And they said that 85 to 90% of Indian population, they are protein deficient. Even those who are eating a non-veg, even they are protein deficient. The first thing, you will look at the protein. And if you keep the detoxification in as a primary goal, I would like to work on soy, as we had mentioned, tofu and soya milk. And then I would like to work on nuts and seed. And my third priority would be sprouts and all the legumes, because legumes also have a good source of protein. And then my fourth priority would be the supplements, that if the patient doesn't have a dairy sensitivity, although majority of patient may be having a dairy sensitivity, I would like to prefer a plant-based protein. So you can work on and creating the treatment approach.
Okay, that's interesting. We have got a very interesting question. What if the SGPT and SGOT are normal, but the GGT levels are on the higher side, and her homocysteine and the C-reactive protein is higher? So does that indicate the liver toxicity?
See, we cannot say like a liver toxicity is a toxic load. Now let's say GGT enzyme, if it is raised, it clearly says that patient is exposed to some kind of toxins and his liver has difficulty in detoxification. So one thing understood from GGT. GGT also will be raised in some kind of insulin resistance where you see some mild elevation of GGT enzyme. But with my experience, I say if somebody is working in a chemical factory and they are constantly exposed to toxins or chemical toxins and they have difficulty and they don't have a nutrition, they usually increase GGT enzyme. And you can consider GGT enzyme as a toxic load and the capacity of the patient's detoxification. So yes, GGT enzyme is indicated a toxicity, and then homocysteine and inflammation you can see from CRP, and is also having a defect in methylation. So your approach should be working in detoxification pathway.
Okay. Uh, how would you correlate constipation with toxic load and how?
See, constipation is your patient is not eliminating toxins, and as you see my slide, 80% of the toxins is eliminated from the feces. But just think about that your gut is not proper, then you will not eliminate that 80% of toxins. Maybe you are eliminating 60% of toxins and remaining 30 or 40% of toxins, they are entering into hepatic circulation, and that is called enterohepatic circulation. So it is very important before even you work on a phase 2, because phase 2, what will the phase 2 will do? Phase 2 will dump the toxins into the gut. And if your gut health is not proper, or if you have constipation, what will happen? You will again reabsorb the toxins. So even before the phase 2, you should work on a constipation. Just do and work on a constipation.
Okay. Since you're talking about phase two, when the gut inflammation is going on, like a leaky gut or autoimmune is set off, since many things are mentioned as a gut irritant, so how do we optimize it during phase
So
two?
now you understood we had changed our priority, right? So
Yes.
case to case, we had changed our priority. Now your priority changed from detoxification to your gut health. See, when you design the treatment, you have to go through the decision-making matrix. And once you do root cause analysis, you will find out and make the priority. And that's the important understanding in doing and designing the functional medicine treatment. And in your case, you are saying that patient having a gut inflammation. So I will change the priority. Why should I work on a detoxification although I see that gut has a problem? So I will change my focus. I will just hold on for detoxification. I will start working from the gut. Are you getting me?
Yes. So if
And
you
my
can
priority is not
elaborate a
to
bit
optimize.
on this.
So my priority is not the gut. And we can take a new case study, upcoming case study on a gut separately. So we'll not discuss
Perfect.
on gut optimization, but here answering a question, my priority will change and I will not focus on the detoxification. I will focus on a gut health.
So for our next session, we can
Okay,
keep gut as a
no, no.
topic and
Our next session is already decided. Our next session is on a complex metabolic disorder.
all right, we shall
I
do
will
that then.
present a case. That case you will find out multiple complex condition, and I will teach you how to map that and from where we should start the treatment. You will learn like this case. You say that from where we should start, from the gut, from the detox. So I will present the next study on a and that is on a 3rd August. And Ankita will send you the link. Please register on
Yes.
the, because that we're going to give you even before you come on a live lecture. you will have some email that will give you insight about the patient history. So that's why we want you to register on that one. So you will get all the information before your live class. So you'll understand the case in better way. So that complex metabolic condition I would like to present, and I will teach you how to map and how to understand that case, and then how to design the treatment approach.
Perfect. So you have already announced the next session, so that's amazing. Those who all are not on the WhatsApp group, please ping me on WhatsApp or ping Momita or anyone you know and connect with me. I'll add you to the group. I have also shared the group link to. I'll share it to Momita and Pradipta, so you guys can connect with them and add yourself in the group. So there is a group on WhatsApp where we update all this. For next session, Momita, I request you to send
Yeah,
the registration link and we shall
definitely I
share
will share
the.
it. And one
Yes.
more thing, that the present participants can go to our website and they can directly register for the new webinar. So everyone can just go to our website and they can just register for the next event. Uh, I would like to request everyone to please go to our website, appvitaone.in, and you will find the event page there.
Amita, you can write you can just put
Yeah,
give
yeah.
a to Ankita, and Ankita will share it in the WhatsApp group.
Yes,
Share over there.
Yes,
I
yes.
shall do
I
that.
cannot waste the
Uh,
time. Yeah, we cannot.
uh, thank you so much, sir, and thank you all the participants. Now the participants have reduced, but if I see the numbers, we were approximately 165 participants. So everyone is quite keen to learn more. Also, we shall announce for our next session, which will be offline. We will announce that also shortly. So stay tuned, everyone. My mobile number, I'm just sharing it on the group chat. It's 9920530009. I have just shared the number with everyone. In case if you don't have my number, please connect with either Pradipta or Momita or anyone who you know who is attending the session. You will get my number directly. So that way we can just add you in the group. So thank you, sir, for your time. Uh, Thank you everyone for being there.
Okay,
And
thank you very much. Namaskaram, everyone, and see you on our next case on 3rd of August. Bye bye. Take care. See you.
thank you so much. It was very much insightful session. Everyone learned a lot. I have shared my number on the group chat. So if anyone have not received it, it's 9920530009. Sorry.
And the moment it doesn't on your basic. Yes, I have also shared the link in the chat box. So if anyone can directly go to our website and register for the next event. And also I have shared to you, Ankita ji. You may share that to
Yeah,
all the participants in the WhatsApp. Oh,
surely. Yes. So I'm just uh anyone who pings me on WhatsApp, I'll share the link with everyone. I have received it from Krishna also. So here we will end the session. Thank you everyone. Uh Pradipta, can you please close the session?
Yes, ma'am.
Yeah, thank you.